Hello, everyone. It's Tuesday, July 5th. Regretfully, but at the same time, it's some level of progress. We've got 5 additional deaths. I ask for your prayers. I ask that you'll please remember these folks in your, like I said, in your prayers. But if you know them, please call them. The 7,065th death in West Virginia is a 92-year-old female from Kanawha County. The 7,066th death is a 55-year-old female from Kanawha County. The 7,067th death is a 73-year-old female from Randolph County. The 7,068th death is an 86-year-old female from Clay County. And the 7,069th death is a 95-year-old female from Jackson County. Active cases in West Virginia are 2,150. We have 1,995 new positive cases since last Friday. I hope you got that. 1,995 new positive cases since last Friday. Our daily positivity rate's at 18.46. Cumulative rate is at 8.18. We do have 525,000 recovered cases in West Virginia. 220 people hospitalized, 29 in the ICU units, and 7 on ventilators. And you can see our state is entirely yellow and green. We don't have enough green. We've got more yellow, you can see. I remind everybody about your booster shots. Now let me just try one more time. And I'm going to keep trying. I'm going to keep trying as long as God gives me breath. I'm going to keep trying. We've had 1,995 new positive cases that we know about in West Virginia today. Now, since last Friday, 1,995 new positive cases since last Friday. I just said that we know about, because a lot of people have these home test kits and everything, and we may not even know about them. But 1,995 we do know. Now, with all that being said, how smart is it when we're sitting here telling you over and over and over that this isn't gone, and this is highly contagious, highly contagious? How smart is it to have been vaccinated and not go get your booster shot? It's not very smart, because your immunity for all practical purposes is gone, and you're just winging it. Now, I know the sun's shining, and I know it's summertime. I know we've just been through a tremendous celebration at the 4th of July, you know, our nation's birthday. I hope to goodness that everyone had a wonderful time. You know, we had the funeral services for an American hero, a West Virginia hero, Woody Williams, on Sunday that was unbelievable. But all that being said, from Jim Justice to you, as somebody that I truly treasure, all of you, I love all of you, and I want nothing but goodness for all of you. I would say to you, there is nothing more important today than going and getting that booster shot. If you're out of the time frame and you do not have any immunities and you got vaccinated, please, especially if you're 50 and older, go get that booster shot. Our vaccine calculator will tell you all kinds of stuff, and it will give you a heads up as to when you should be getting your next shot. But you know it. I mean, for crying out loud, you know if you're 4 months out or 6 months out or 8 months out or whenever it was that you had your last vaccination, if you're out anything close to those kind of numbers, you got to get that booster shot. All the stuff about our COVID vaccine line, info line, is all up on our website. We have 71 outbreaks in our long-term care facilities, none in our church community. We have 54 inmate cases and 29 staff cases. You know, I've told you we're going to have an announcement tomorrow. We're going to have to put that off till Thursday. We'll double up on Thursday with a COVID briefing as well. But we want to just get the numbers and everything refined. We still have a whole lot to go to get that right on the money. We've gone through this, holiday weekend. We thought we'd have more done than we've got right now, but we've got to refine it a little bit more. So we're going to put it off a day. So you won't hear from us until Thursday on that. The rental assistance program, the homeowner assistance program, is for rent. The rental assistance program is for renters and landlords with the permission of the renters. It's still there. Significant money is still there. If you'll call us, you may very well be able to qualify, and it would really save you really put some real money back in your pockets. From the homeowners assistance program, same thing. Call us. Please call us. I remind everyone about giving blood. You know, I also remind you to check with your physician and see that he or she, says that's a good thing and you ought to consider it, and then please just think about it. We need the blood. I mentioned earlier about Woody Williams' funeral and everything. It was an honor to offer our capital, for Woody Williams to lie in state this weekend. This is only the third time in history West Virginia is laid in state. In fact, it's only the second time at the Capitol we have today, and it's the first time in our state's history that a non-elected official, received this honor. It was an honor for Kathy and I to be there. I've said it over and over that not very many times, really and truly, do you get to know and become real friends with someone that is a true American hero. The last recipient of the Medal of Honor, of anyone that served in World War II, Woody was 98 years old. He spoke with, an eloquent tone that was off the chart, and just an amazing, amazing man. Devoted his life, his passion to the Gold Star families, devoted his life to community, to getting more and more and more done. I said at the funeral, I said, what really drives this level of courage? What drives this level of passion? What drives this level of service to community and love for your state and love for this nation? And I really truly believe, and I believe this with all in me, I believe that God made Woody Williams for a reason. He made him who he was for a reason, and I believe for all of us that God does exactly just that. A plan that was way beyond our comprehension. But with all of that, we were blessed and blessed beyond belief to have this great man and have him as our own. And so it was a real honor, and we're going to go on with further honors because he's going to lie in state at our nation's capital, and that announcement came while we were there. In fact, just a little before the funeral started and everything, Senator Manchin mentioned that he had gotten word, from the higher ups or whatever that everything had been approved and everything. And Senator Capito was there, and I didn't get to see Shelley. I saw her, but I didn't get to talk to her. But what an incredible job she's done and everything, as well as Senator Manchin. And I think Congresswoman Miller was there. I think Congressman McKinley was there. I didn't get to talk with them all, but nevertheless, it was a great day, a great celebration for an incredible man. I've got some not so good news here, and we're going to push back. We're going to fight it as hard as we possibly can. But today, we've been informed that FEMA, has ruled that the damage from the storm was not enough to qualify for the counties of Cabell, Putnam, and Roane counties, the storm of May the 6th. So we're pushing back. We've got 30 days to appeal. We're going to do so, and we're going to push as hard as we possibly can. But it's a disappointment, to tell you the truth. And the only last thing I've got is there's There's a bloodhound. Her name's Racy, and Racy is being retired. Baby Dog and I had the opportunity to meet her, you know, and what incredible work she's done the last 10 years, you know, for the state of West Virginia. You know, she's just as gentle as she can be, just absolutely just in her own way. You know, just think of all the great work that she's done. You know, I'm going to read this to you, but over the course of her 10-year career, Racy has been part of 197 wildfire arson investigations in West Virginia. She has sniffed out 29 missing person cases and has helped with 78 criminal investigations for outside agencies. You know, we'll miss her. We want her to enjoy her retirement with her trainers and everything, but really neat stuff. You know, our companions, our canine companions are really, really special to me, but you know, really great stuff. So Racy, we'll miss you, but we want you to enjoy your retirement. You know, and thank you so much for all you've done. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and as the governor said, we continue to be vigilant related to COVID-19. We know that across the world, the Omicron variant, the BA.5 variant, has now become the dominant variant in many places in the world and also in the United States. We know that this variant is very, very, has the superpower to be able to evade the immune response that people may have had if they had been infected with previous variants like the Alpha variant, which was the variant from the United Kingdom, the Delta variant, the variant from India, or even early variants from Omicron, like the BA.1 variant. So we know that people in the country have been getting infected at a bit of a higher rate, and we've started to see some of the hospital numbers go up around the country, particularly where the BA.5 variant is setting up shop most quickly, which includes larger cities, as we've talked about before. West Virginia is oftentimes a few weeks behind the rest of the country and seeing the newer variants come. But in places like the United Kingdom and places like Portugal, we have seen this variant cause a lot of increase in new cases. In Portugal, we've seen the number of hospitalizations increase as well as the number of deaths, and that's an older population. And we know that data from the CDC would suggest that people over 50 years old who have gotten their primary vaccine series and at least 2 boosters, and that's what the governor was pleading with people to do, have a 42 times reduced risk of death than people that have been unvaccinated, and a 4 times reduced risk of death from people that have been vaccinated with a primary series and only 1 booster. So the 2 boosters or more in people over 50 is associated with a significant benefit and reduced risk of dying from COVID-19. And so it's really important that people who are in that age group, please go out and make sure that you're up to date with your vaccines using the vaccine calculator and being able to understand when you're eligible, and then with the vaccine calculator, you can schedule that right there and get an appointment to get vaccinated. Otherwise, we know that long COVID is becoming a bigger issue. In the most recent study, up to 25% of people that have had COVID at some point have developed symptoms that would be consistent with long COVID. And those symptoms can vary from feeling fatigued to short of breath, to not being able to think as clearly, the quote unquote brain fog from COVID, but also blood clotting episodes, including strokes in younger people, heart attacks in younger people. So it's really important that you get vaccinated, because vaccination, full vaccination with boosts, is found in studies to be 10% to 50% protective against developing long COVID symptoms, depending on which study you read. So simply, it's really important for the health of our populace, for the well-being of our population, given the risk factors we have, the age, the third oldest state, and a state with many chronic medical problems, that people please consider, if you haven't been up to date on your vaccines, to go ahead and do that. And unfortunately, only about a third of people in the U.S. have taken advantage for that. And we certainly hope that people in West Virginia who are over 50 will continue to lead the way for others. Thank you so much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As Governor and Clay pointed out, our hospital number is around 220, so just short of half of what we believe would be a challenging point for us. We continue to monitor that, and we'll continue to monitor specifically ICU and ventilator use, which seems to be trending lower than what we have seen in the past. So that is, in fact, a good sign. As was pointed out by the governor, we continue to have great success with our vaccine calculator, well over 400,000 calculations, and the calculator is tending to pick up a lot of momentum, people using it for updating the most important things of not just first doses, which we still continue to see a small trend in that direction, but more importantly, as Dr. Marsh pointed out, are over 50 booster shots. We do, if you look at our data, we do have still a good uptake of vaccines for people age 50 and above, and people age 50 and above are listening to the governor's message and the team's message about getting those booster shots. Still some confusion out there as to whether you need to get the fourth one, and we believe that our calculator will continue to help with that. Our focus right now is on providing more information to providers and caregivers, because we know that those are the trusted agents for people who will go out and get vaccines. So as the governor pointed out, he continues to press us daily to keep up that effort, because we know how important it is. Last thing, Governor, I want to thank you, your staff at Culture and History, your staff within the governor's office, our two United States senators and their staff, as well as the National Guard and United States Marine Corps, for doing such a terrific job of sending Woody Williams off with that great event at the Capitol. It's a true testament to what President Lincoln pressed us as a nation, that we need to continue to care for our veterans, their families and their children, and we need to continue to show not just that particular piece about a veteran, but what Woody Williams stood for. And we all need to get back to that, about taking care of each other and having respect and care and concern for each other. So again, I thank you for the efforts to send our friend Woody off with great honor.
All right, thank you, sir. Also joining us today are Dr. Ayn Amjad and Secretary Bill Crouch. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. I was a little confused when you said that you were going to put off an announcement until Thursday, because you didn't really specifically say what that was. I noticed you didn't go into the revenue numbers. I know the numbers that came out from the Senate Finance Committee Friday showed about a $1.3 billion surplus, which is obviously record breaking. I didn't know if you wanted to talk a little bit more about that, or if you are saving some more additional information for Thursday, waiting for some more receipts to come in over the holiday weekend, if that's what you were alluding to. Thank you.
Stephen, I could talk an awful lot about it. It's record breaking, record shattering in every way that you can just imagine. But we've got a whole lot more detail and everything, a lot of stuff to come and everything. I think it'll be an exciting day and everything. And if it is possible and everything, we'll switch it back and we'll do it tomorrow. But I think really to gather all the information that we need and to get it in a format that really is really good and everything, we'll need till Thursday. But I think it's best to wait and we'll talk about it on Thursday in real detail.
All right, thank you, Stephen. Next to Mark Curtis with Nexstar Media. Mark, I think you're still muted there. Okay, we'll come back to Mark. How about Randy Hoey with West Virginia Public Broadcasting?
Yes, I can unmute. I just want to say I spent the weekend at the Capitol and was so touched. When that plane split off from the flyover, that just got me. When the commandant handed that flag to Ms. Ross, his soft-spoken words and the tear in his eye were just incredible. What an event! What a send-off for a hero. Governor, I just wanted to, I guess Stephen kind of followed it up, but will you talk on Thursday as well about allocations? I've been told that July is allocation month, and I've been talking to people like members of the Coalfield Grant Commission, where the money will go, and will we talk about allocations of this $500 million or wherever that surplus is on Thursday as well?
Randy, we will talk some about that, and I don't want to disclose everything that we're going to be talking about because we don't have it finalized. I mean, you know me, I would tell you, I'm not one to keep secrets, and I'm not one to hide stuff and everything. I just don't do that, But we'll go through detail after detail and sector after sector and everything, and we'll give you an awful lot of information because there's, you just can't whip this together, especially with everyone, being at the funeral, everybody's, being off over the 4th of July and everything, and it just, there's a whole lot of gathering of information that we need to have, and you need more detail on me calling a special session in regard to the Roe v. Wade decision and our antiquated laws and recommendation from the Attorney General there's a whole lot more information that needs to that we need to discuss and everything, and I hope we'll be able to cover most all that on Thursday.
All right, thanks, Randy. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for General Hoyer. You mentioned that you guys were focusing on the ICU and the ventilator numbers. Are there specific benchmarks that you guys are looking at there? Thank you.
So, Charles, don't have specific numbers on ICU and ventilators. But we watch them to ensure that we have plenty of availability compared to what the caseload of current hospitals are during summertime peak use of hospitals. So no specific number. It's based on trends in each individual hospital and location. So not a statewide number that we're managing. It's more focused around each individual hospital.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Greetings, folks. Sorry about the technical problems. Let me just say, job well done. First class send off for Woody Williams. Congratulations to everyone in this state that was involved Saturday and Sunday. I was there both days, and there just are no words. It was truly remarkable for a remarkable man. I have a question on a different topic. You may have heard that yesterday the federal judge ruled against Cabell County and Huntington, denying them the $2.6 billion they wanted for drug abatement. Another case is getting started in circuit court today here in Kanawha County, seeking abatement money for treatment, education, drug prevention, and even law enforcement efforts for many cities and counties in the state. I'm not asking anyone to make a judge on the judgment's ruling or be critical of the judge. I'm asking how critical this money is for so-called drug abatement, that we get it going forward for education, treatment, prevention, and law enforcement. And I'd like the doctors to weigh in, especially with how bad is the opioid epidemic now, and is it getting worse? I know we had a lot of problems during COVID. How bad is this money needed to deal with all these problems going forward? And one last question about that, might there be some of the surplus dollars, Governor, that could go towards that? I know it's a lot.
I didn't get the very last part. What did you say there, Mark, the very last thing?
Governor, I was wondering if any of the surplus, the $1.3 billion surplus, might be able to be used for some of this drug abatement money that the courts are denying. I mean, the need is still there.
Mark, I guess I'm gonna defer, on answering that question, till later and everything. I'm not going to postpone it forever, but we need to remember just one thing, and that is just this, the opioid situation is really tough, and it was super horrible. And we've done a bunch of things, whether it was Jim's Dream or Jobs and Hope or whatever it may be, we've done things to make things better. But we all know that the situation today, we're getting overrun from our southern border, and we do not, as a nation, we do not respond. Fentanyl is all across the state of West Virginia. Well, it just didn't come here from no man's land. It's coming here through the southern border. And that's a real problem, a real problem. From a standpoint of my feelings about the rulings that have come down, I'm disappointed, absolutely, without any question. From the standpoint of the situation, on FEMA, I was down there. God knows, I've never been through anything in my life like the 2016 flood. But there's so many memories of exactly just that. House after house, family after family, all their possessions, all their memories, mud all over them everywhere, and out in the street, piled up in a pile, getting ready for an end loader to come along, throw them up in the back of a dump truck, and off they go. I don't see how we turn our back. I do not see how that we turn our back if we're FEMA on that. And, so whether it be rulings in regard to opioids and these big drug companies and all that, or rulings by FEMA, there may be somebody, there may be a governor that wouldn't want to talk about that, but it isn't this governor, and so I guess let me defer to the other parts of the question, and I think our medical team and everything, Dr. Marsh, Dr. Amjad, there was another part of the question that you guys have.
Hi, do you want to start? Do you want me to?
You can start, Clay. Thanks.
Well, Mark, thank you so much for a very important question. And we certainly know that not only in West Virginia, but across our country, the issue with substance use disorder is significant. As the governor said, many programs that have been started through the governor's leadership and also in West Virginia with Matt Christensen and other people helping lead the way is really trying to approach this in a multi-pronged way. We know that many people have said in different ways that a critical factor in substance use disorder are people feeling isolated and disconnected from both personal value, the so-called deaths of despair and hopelessness that have been articulated by the Sir Angus Deaton, who won the Nobel Prize for Economics at Princeton University with Ann Case, where they identified a group of 45 to 55-year-old non-Hispanic white men, non-Hispanic whites who had a high school education or less, who were dying at a rate that was as high as the peak of the AIDS epidemic, and that was before COVID. 218,000 people died in 2018 from this problem. And they found that really they were dying of substance use, overdose, and suicide, and alcoholism. But as they got deeper, they found they were dying of despair and hopelessness. And Appalachia was really the heart of the problem into the Ohio River Valley. It was really around job loss of people who had secure jobs in coal mines and other manufacturing places. So as we start to look at this problem, it is a multi-pronged problem of support, jobs, education, because it looks like a higher education degree is a resilience factor against this. So this is a very challenging problem. And as the governor pointed out, the state has done many things to try to improve the state of this issue for people in West Virginia. But as we have pointed out during the COVID pandemic, the isolation and the loneliness got even greater. And we saw that for the first time in our country's history, 100,000 people, Americans, died of drug overdose in 2020 to 2021. So this is a very significant problem. Certainly more resources put smartly, as we have tried to do in West Virginia, is part of the solution. But this is a generational problem. And not only do we need to reach out to the people who are suffering today with this problem, but very importantly, we need to also take care of our children, because the more traumas they experience, the more likely they are also to both have drug abuse, overdose, but also shortened lifespans. And the US during COVID has seen a 5-year reduction in lifespan versus other westernized countries of the same socioeconomic value as us, and a 2.5-year reduction in lifespan during COVID, which includes people who have died of overdose or substance use disorder. Throw it back to you for additional comments.
Thanks, Clay. No, you summed it up. The only thing I want to add to Mark's question is that it is a focus at the Bureau for Public Health as well as the drug control policy, and with the governor's support, we are still continuing to monitor anyone with substance use disorders through various meetings, whether it's increasing Narcan available throughout the state, educating young people. So any resources are definitely needed in terms of funding. But in addition to that, I think we have a great team out there working very hard to do what we can do, even I'll say with or without funding, but we always would appreciate more funding for those efforts. But this continues to be a priority for us here at the state. Thanks.
All right, thank you, Mark. Governor, I'll turn it back to you.
Okay. I guess one point that I picked up, and again, in trying to always listen to the experts, Dr. Marsh made mention of side effects from COVID to our young people. He even made mention of, and God forbid, young people and stroke. And so all across this entire spectrum, all I would say is the same thing I've said 10 million times. The vaccines are safe. For all we know, the vaccines are really safe. Absolutely, they'll save your life. Without any question, if you're out a number of months from the last time you had your vaccine and you need a booster shot, not taking that booster shot is not smart. That's all there is to it. And not putting it on the top of the shelf for something that is a priority that you need to do right now is not smart. So please consider, please consider that. And the only other thing I have is, if by chance we can get all of our information all put together and I feel comfortable about it and everything, we'll put out a notice to everybody, and we'll try to go tomorrow instead of going on Thursday, so we won't have back-to-back, briefings. So, with our press release that I intended to do tomorrow. So, like I said, we got some work to do. I don't think we'll be able to get there till Thursday, but if we get it, to all the news media, just look for it and everything. It may very well be that we go tomorrow. Nevertheless, that's all I've got. Thank you so much.